Let's talk about the NHS right now with Dr. John Puntis. He's co-chair of the campaign group Keep Our NHS Public. Very good morning to you, John.
Good morning, Julia.
Thanks for joining us. Well, we've got some of the latest stats out on the NHS today, and it's, what a surprise, busiest year on record for emergency services over last year as winter flu pressures rage on. Got an average of over 5,400 patients a day in hospital with flu in the last week, 256 of those in critical care. It's 3.5 times higher than the same week last year, because we know we have different rates of flu and other bugs every winter. They come through, in different weeks every year as well. But we've got more than 20 trusts, I think, declaring critical incidents, exceptional demand, 50-hour waits in A&E in some hospitals. But are you surprised that the last year was the busiest year on record for A&E and ambulance services?
Not really surprised, because it reflects system-wide problems, doesn't it? So access to GPs, ambulance handover delays, A&E being full, and the issues with not having enough beds and not enough staff.
But also an ageing population.
Yes, to some extent that's true. Of course, if you age and you remain well, healthy, aging is not necessarily an extra burden on the NHS. I don't think we should overemphasise that.
But if you have the baby boomer generation, my parents' generation, in their early 80s now, they're the people who are more likely to be stricken badly, need hospital treatment for, bad flu or, any other, COVID or any of the other respiratory illnesses, rather than someone, say, of my age who just sort of stumbles on for a month with a cold and a cough.
Indeed, and hopefully they've been targeted for flu vaccination, being in a high-risk group. But what I'm saying is that the problems in the NHS are system-wide.
Yeah.
I would argue that they're predominantly related to low staffing, low bed numbers, and underinvestment, which was a theme that was identified strongly by Lord Darcy in his report.
But this is the thing a lot of people find incredible to comprehend, is that how have we got low staffing and low bed levels when we have record levels of money going into the NHS right now?
Well, of course, if you gave the NHS £1 more each year, it would have record levels of funding. So that doesn't really...
No, we are talking of tens and tens of billions of pounds of more money. By the way, so much more money than that talk of £350 million extra a week. Way more than that more is now going into the NHS.
Well, it's not enough to meet demand, is the answer.
What would be enough?
Well, I would like us to be spending equivalent to comparable European countries like Germany, Netherlands.
We're not far off the spending of a lot of those countries on our healthcare.
If you look at per capita spending, we're quite a long way off, and it's
not
been
anymore. We used to be. We're not anymore.
Like 40 billion more is spent in some of the comparable European countries. So I think there is still a very big gap.
Well, 40 billion a year more, but they've got bigger populations as well. I mean, there are the different ways of making those comparisons. They also have completely different systems of healthcare. They have social insurance models, which bizarrely deliver far smaller waiting times and far better outcomes for things like cancer and heart disease and diabetes treatment. Some people, like you, are obsessed with having our monolithic state-controlled system of the NHS because you think that's the answer, despite the fact that no other country in the world other than Cuba thinks it is.
Well, there are other countries, of course. I mean, Portugal is one example. Its NHS model on the NHS. Italy, Scandinavian countries.
I'm sorry, those countries do not run their model. Their healthcare models are not based on the NHS anymore. They are not run like the NHS as one monolithic.
Largely based. And I think the 40 billion more relates to per capita spending. So it's not just about bigger population. Of course, they manage their services in a different way. They have social insurance. The problem with that is that adds in an additional cost to the whole thing as well. So
does that account for the 40 billion?
We argue that the NHS is still the most cost-effective way of providing comprehensive care.
It is cost-effective. There's no doubt at all about that. It's not as wasteful as actually an awful lot of other systems. Bizarre, terrifyingly. But bizarrely, the outcomes for going to the NHS as opposed to going into the French or the German or any of these other healthcare systems are worse. The NHS, as I've always said, it's a great system unless you want to actually keep people alive. It's not very good at that.
Well, I think if we were to invest in NHS staff, equipment and facilities, I think we would find that outcomes...
But the money's there.
Improve.
Huge sums of money are available right now and have been available for the last few years. Yes, there were the austerity years. Of course, there were. Choices had to be made. But there's no doubt at all there is tens and tens of billions of pounds more money now going in the NHS. What's it being spent on?
Well, the NHS always had a 4% uplift each year until about 2000, and then that has gone down. So we're actually in one of the most financially constrained periods of the NHS at the moment. Integrated care boards are having to make £8 billion worth of savings at the present time.
Yeah, well, I mean, but they've still got diversity officers and net zero officers, and everyone's still plenty of time to make TikTok videos, bizarrely. Dr. John Puntis, I have to leave it there.